There are a number of different areas I'm going to be discussing today, and these include this feeling that what a relief, it's all over. So why do I feel like this? A new diagnosis of cancer can be a busy time for patients, with pre-treatment hospital appointments, coming to hospital, having surgery, and then seeing lots of doctors and nurses as you recover from surgery. But when you're discharged from the hospital, it can be a very frightening time for our patients. Contact with the hospital seems to stop suddenly, and this can result in patients becoming anxious and worried. I'm going to talk about the future. The future is not always certain. There is no guarantee. Some people will have had treatment to try and cure you of the disease. In some other people, they will not be able to have curative treatment. Dealing with the uncertainty of cancer can be extremely difficult, but there are strategies, courses, and methods of dealing with this uncertainty that we can help you with. Moving on to follow-up, it can be confusing. What is follow-up? Why is it needed? What will happen? Where will it happen? And what is it all about? We know that your cancer diagnosis can affect other people in your life, including friends and families and carers. So we'll touch on this today. Many patients ask us about lifestyle changes that you can make to make a difference, and we will discuss this later. Patients often express a concern about the tumour coming back in the future, and we'll also go over what symptoms to look out for, which may ease some of your concerns. So many patients will experience some or all of these thoughts. For some people, these are transient worries, and they tend to fade as the worries are addressed. In other patients, you can become very troubled with these thoughts. And it's vital to remember that everyone is different. There is no normal. Colorectal cancer is different for individuals, both in terms of the surgery required, chemotherapy required, the use of preoperative treatments such as radiotherapy. The longer terms of treatment varies between individuals. Some people have stomas, some people don't. Each of these scenarios mean that there's a very different patient experience, and the experience is unique to individuals. Please remember that everyone is different, and everyone deals with things slightly differently. But many concerns are common to many people who have been through the same experience, and talking about them, voicing these concerns, can help enormously. So this is us. You hopefully will know some of the faces I'm showing here, particularly Debbie, Helen, and Pat, who are the conductors of our team. Wendy is our coordinator, and hopefully you'll recognise some of the surgical faces that I've put up here in this slide. But in the background, there are many more healthcare professionals helping you through your journey, and these include dietitians, enhanced recovery nurses, physiotherapists, the ward nurses, stoma therapists, anaesthetists, oncologists, and junior doctors. Helen, Debbie, and Pat, our colorectal specialist nurses, are crucial and central to the team who are helping you. If you have concerns, do not be afraid to bring them to our attention so that we can try and help you. No concern is too small or silly. It may be something that we can help you with, and it's often something that we've heard before from our patients, and we should be able to address and deal with that effectively. In our patients living with and beyond cancer, there are common feelings that our patients express. People often feel isolated. That might be because they're not seeing the doctors and nurses after their treatment. It may be because they're not seeing their friends and family as much, or they're not returned to work yet. Feeling isolated, telling friends and family about these feelings can help. But in addition, our colorectal specialist nurses can help and support you too, and direct you to support groups and online networks. Uncertainty about the future is a common worry for many of our patients. And for some patients, it may be intrusive. It may stop you planning the future and enjoying your life. This often gets better with time, and taking simple steps such as taking control of your lifestyle and having an organised and structured day can improve this too. Setting achievable and realistic goals can be helpful for most people. Negative feelings, including anger, are a common part of dealing with your cancer. Everyone will have days where they feel low or depressed. No one can be positive all the time. Talking about your feeling can result in a positive result, and it helps you to acknowledge how you feel and helps you deal with it. Feeling tired, sad and down after treatment is normal, but for some people, these feelings do not improve, and this can lead to depression. If you think this is happening to you, please talk to your doctor or nurse, as there are treatments that can help. Dealing with these feelings and developing strategies is important to help you cope. There are additional courses such as the HOPE course, which is run in the Macmillan Centre, that you may be able to attend. The HOPE course runs over a number of weeks. There are many patients from different tumour groups that go to these courses. You come together, talk about your problems, and work together to develop strategies to deal with them.